The Monica Makes It Happen podcast is proudly supported by Ponce Bank.
Hi, everybody, and welcome to the Monica Makes It Happen podcast. Thank you for watching wherever you're watching. We always appreciate you. It's always about you. And it's always about our community champions. A lot of them are CEOs really showing up for our communities, our favorite communities, big time. And well, I don't know how I got this lucky, but I have a friend at Metropolitan, which is one of the best hospitals in our area. And I happen to know the CEO who is here, sitting right here with us. I love this. Julian, John, I do think you should have your own show. With a name like that,
Okay.
it's too good.
I'll think about it.
I think you're going to have the best guests
Yeah.
too. We're going to talk about that a little bit later on. I want to hear who you think should be on my next podcast. But first, the amount of work that you do in the community. I always like to know that the people at the top are doing not just the work, but they're doing it because of a reason, because of their own story. So I want to hear a little bit more about what makes you go, what makes you do such incredible things for the community, why community hospitals are so important, and how our viewers can benefit, because healthcare is so expensive. I always get nervous when I go to the doctor. Between you and me, is it covered by insurance? Is
Mhm.
it this? Is this?
Mhm.
But you've made it your life's mission to be a community hospital. What does a community hospital mean? And why is it so important to Metropolitan to be so community focused?
Well, thank you for having me on your podcast, Monica. So, a community hospital is basically a hospital that serves the local community. All right. We offer an array of services, inpatient services, rehab services, psychiatric services, and we do have a large array of ambulatory care services as well. It is our mission to make sure that we are taking care of our community, and our doors are open to anyone who walks in to our doors.
Anybody.
Anybody. We ask no questions. We are committed to caring for the person, regardless of gender, race, ethnic background. We don't care. We are all about taking care of the individual. And so my passion, with regards to healthcare, obviously when I first started early in my career, I did not think about working for a hospital. I was more focused on finance. I graduated with a bachelor's in accounting.
I did not know this, which is so interesting to me. A lot of the CEOs start off going one way
Yeah.
and then end up. So you were a finance person,
Yep,
very, very
absolutely.
successful
Yeah.
finance. And then how did this hospital thing happen? How did healthcare fall
Get
into?
in how
Yeah,
did healthcare find me? Yeah.
yeah.
So my first job out of college was with an accounting firm, a Loeb and Troper. I don't think they exist anymore, or maybe under a different name. And one of the clients that I had was a hospital, actually Kingsbrook Jewish Medical Center. And they were impressed with me and offered me a position within their finance team. And so I figured it's more money, so I'll take the job,
Yeah.
not knowing that my entire career would be in healthcare. Um, so I started off as an accountant, spent 8 years at Kingsbrook Jewish, went over to Kings County Hospital, which is part of the health and hospital system,
Mhm.
spent 15 years there, then went to corporate office as a corporate controller, and moved around a bit. Went into Faith Medical Center in Brooklyn, which is part of the One Brooklyn Health System. Came back into health and hospitals and went to Lincoln. Spent 2 years there, and
Love
then
Lincoln
moved.
Hospital.
Beautiful
I've done so
hospital,
many stories there.
and is now being run by a great leader, Christina Contreras, who was my former boss at Metropolitan, actually. And then went on to Metropolitan. I've been at Metropolitan now for just over 4.5 years.
4.5 years. And that's
But
pretty
healthcare
incredible.
is, for me, it's a commitment. If I had to do it all over again, I would do the same thing.
Really?
Yeah, I would definitely be committed to probably at the inception, maybe doing something different, maybe becoming a doctor. But healthcare is critical. My own mother, unfortunately, she died of bladder cancer. And I felt that the care that she received was substandard.
Oh, wow.
And so that made me even more committed to ensuring that the hospital that I work for would be the best hospital possible and offer high quality care to anyone. Um, and So that's something that
What
is
a
really,
story.
yeah,
See, I knew there was a story there
yeah,
because you are so mission driven. I met you at the Schneps event for
yep,
women, and you're honoring women. So you're
absolutely,
honoring your mom. Every time
absolutely,
you help a family
absolutely.
get this incredible health
You
care.
know,
Yeah.
unfortunately, and cancer is a big focus. Unfortunately, I have an aunt who died from lung cancer. There was another aunt who died from cervical cancer. And so it is really, it's not something I talk about a lot, but
My
definitely
gosh.
it drives me to make sure that Metropolitan Hospital provides the best care possible.
So you're telling me three of
Yeah.
your loved ones,
Three
women,
very powerful women in my life.
your role
Yeah.
models, your
Hmm.
mentors, your everything,
Yeah.
died. All three of them died of
Hmm.
cancers.
Absolutely.
And, I hate to say it's not rare. A lot of us have cancer,
Hmm.
but
Yeah.
that's harsh.
It's
It's a
harsh.
harsh,
It's harsh. And could it have been avoided? Yes, I think, in some instances it could have been avoided. I think late detection and mistreatment or misdiagnosis
mhm,
caused my own mother's demise.
yes.
And so I'm proud to say that at the hospital and Metropolitan Hospital, we're now almost ready to open our new infusion center. And I can't wait for the day to come
Ah,
when that infusion center opens,
ah,
because it's great. It's overlooking the Hudson River, um, and it's a place that's conducive to healing. And so I'm very proud that we are going to be soon opening our brand new infusion center,
well,
hopefully within the next few
we
months.
have to be there. You know that. Pix 11
Absolutely.
has to be
Yeah.
there. We have to do a story on it. But it's when you were saying this, I was thinking that now I know why we get along
Hmm.
so well. Is my mom also died of cancer.
Hmm.
And I feel her early detection, but she got the best care after
Hmm.
once we found out. So we did the best we could. But every time I help specifically a woman, and I
Hmm.
look in their
Yep.
eyes, I think of my mom. And I think that's
Absolutely.
why I'm so driven for
Yeah.
housing, healthcare, food, because no one helped her.
Hmm.
And I think you're the same exact
Yes,
motivation
I
here.
agree. Mothers, you know, for men, your mothers are the ones who already show you it's your first love, right?
Yes,
Basically.
yes.
And you don't want to see them suffer. And also, each mother is a reflection of your own mother, right? And so you want to be sure that you are able to take care of other mothers as well. Yeah. So,
This is so deep because I was just talking about how my husband, and I'm going to
mhm,
bring it up because I think it'll help maybe
yeah.
a man listening. He does not like going to the doctor
Mhm.
and he was not feeling well. And then his mother said to him, go see the doctor. And then he finally went
Right?
today. And I've been begging him. So, I think there is something, the power of moms and
Power
the
of
fact
mom.
they have
Yeah.
these three incredible
Yeah.
maternal and they're guiding you and they're helping you
Yeah.
with and moms are holding up these communities, okay? And they're
Absolutely.
the power force of our families
Yeah.
and our communities. So when we come back, we're going to take a commercial break. I want to keep talking. We're going to talk a little bit about men's health because I think that's really
Hmm.
important. That's a
Hmm.
passion for you. But also this ER. I want to talk about this ER a little bit so then we can take your team is going to want to take that and put it on their social medias because we're on a mission. You are on a mission to make this happen for
Yeah.
East Harlem. That's right after this break. And we're back. It's the Monica Makes It Happen podcast, always partnering with Ponce Bank. Thank you, Ponce Bank. And we are joined by the CEO of Metropolitan, one of my favorite hospitals in the heart of East Harlem. Thank you, Julian, for joining us.
Thank you for having
Julian
me.
John,
Yeah.
who's going to have his own podcast soon. And hopefully I'll be a guest on that show as well. But talk to me a little bit about men's health. This is such a passion for you. We
Yeah.
already talked about how women in your life really shaped who you were
Hmm.
and why you're so community driven. But let's talk about the men in your life and
Yeah.
seeing men's health really being on the back burner
Yeah.
sometimes. Why? Why is that?
Because, man, from my perspective and from my observation, despite having opportunities to receive quality care, receive services, they do not take advantage of the opportunities.
Mm.
They are resistive to seeking care, and they seek care only when something really bad happens, right? And so, my goal for the community that we serve, Black and Brown community, is that we need to be out there as a community hospital talking about some of the diseases that impact men, prostate cancer, lung cancer. Men are also impacted by breast cancer, and many men are not aware of
Mm.
that. Okay. And so it is our plan as a team at Metropolitan to be strategic in how we um, reach out to men in our community.
How
And
do you
we
do
are,
that? How do you do that
so
strategically?
one, I'm educating not only men, of course, women as well, their partners. So making sure we go out into the community. Um, we have spoken to some of our elected officials to create forums for us where we can come into churches, talk
Oh,
about
that's a good idea. Yeah.
healthcare needs that impact men.
And you're right in the community, so you're just
Yeah,
right there. You're in the
yeah,
community, so it's easier to get to you and to be there. Mental health
yeah,
is we're seeing so much, especially with our young people. What is
absolutely.
going on, Julian?
Well, we've seen a trend, not only for adult, but also adolescents, young kids. And again, we are trying to address that concern in our community. We are partnering with schools to go into the schools to talk to kids because, I think they have a lot more stresses than kids 10, 15 years ago.
Yeah,
How can we reach out to them? And kids, they don't really talk much,
they
I guess,
don't.
because they're so addicted to their phones. And
We were
so,
talking
yeah,
about this earlier. We both have
yeah. So, how
experiences.
can
Yeah.
we come into the schools and talk to the kids about some of their healthcare needs as it pertains to mental health?
You know what I love as a
Uh-huh.
dad and a mom? I think what you said was so maybe tweetable,
Mm-hmm.
is that because I sometimes I feel like they're not talking to me. I
Mm-hmm.
have adolescent children too, and they're not talking to me, and I'm so trying to get information. But what you said was so profound. You said, "Stop." They're listening to
Yeah.
you, and it's true. They're taking it
Yeah.
in, even though you feel like you're doing a TED talk.
Yeah.
Like I feel like I'm doing TED talks. No one's responding, but you said that they're actually listening, so they take it in because you're a little bit ahead of me
Yeah.
with your kids. So I think that's really so don't give up is what you're
Don't
saying.
give up. We have to continue talking to our kids. One, you can force it down their throats. We have to be able to communicate to them, not as friends, but in an advisory capacity, you know.
Mhm.
But we cannot stop talking. We got to keep talking. And also try to engage, other members of our families. Because many times kids would not listen to their parents.
That's
They may
true.
listen to an aunt,
Yes.
uncle, that
Yes.
they feel that they can talk to them and say things that probably mom shouldn't hear or
They
dad
love
shouldn't hear.
auntie.
Yeah.
Yeah, they love
So
auntie.
maybe sort of connecting with other members of our families to see how best we can connect with our kids, right? It's all family, right? It's not just parenting is not just about the parents themselves. It takes a village to raise a child. And so we have to be able to connect with those people within our villages who can connect with our kids.
I love that. And the ER. You
Yeah.
have this is a big story actually.
Mhm.
We probably should have led with this, but we're going to do some TV stories on this. Your ER, you need a new emergency room. It's
Absolutely.
East Harlem is growing leaps and
Yeah.
bounds. We know that it's one of the
Yeah.
best jewels in New York City community wise. What's going on? Like you need
Yeah. So we have outgrown the space that we have. Currently we're at 15,000 square feet. And that's back this goes back to 1950. Yeah.
1950?
And so things have changed. The community has grown. And so we are seeing more patients in our ED now. It's not inefficient patient flow. There's not enough privacy. And I have to commend the team in the emergency department, the nurses and the doctors and the ancillary staff who make sure that that emergency room looks like a brand new emergency room in the sense of cleanliness, that we provide high quality care, regardless of whether or not it's tiny.
But,
Yeah.
75 years you haven't
Yeah.
seen And the community in 75 years has grown leaps
Yeah,
and bounds.
yeah,
So you're waving the flag saying, "Come on,
yeah.
guys, we need help." And so moving forward, what is the ask? Like, what do you need to make happen here?
So the ask is $110 million. But before I even talk about that, I have to say, Metropolitan has been around for 150 years. That's no, I mean, I think we're probably one of the oldest hospitals in the nation. And we want to preserve Metropolitan for another 150 years. And the emergency department at this point is one of the important things that we need to ensure that we receive, that we're able to develop, so that we can create that foundation that would take us into the next 20, 25, 50 years. We provide high quality care. And so we need an emergency room that complements the high quality care that we provide to our patients. And our community deserves a
Yes.
better emergency department.
That was it. The
Yeah.
community deserves a better emergency room. And I love that because this is where we are going to follow up and we're going to
Hmm.
stay on top of it. But you've made so many partnerships already.
Yep.
But again, if there's an angel listener, we always say we have
Oh,
the
yeah.
best, most generous viewership. $110 million is what you're looking to
Hmm.
raise, and you need to do it within 6 months. Is that right? Six
No,
months, or what have you done?
we're looking to get it as soon as possible, but fundraising is not easy.
No.
And
Yeah.
so we're looking, um, the former Deputy Speaker, Councilmember Yala, has been a vocal
Yes. We love her.
supporter
Yes.
of,
Yes.
of this emergency room.
Yes.
Um, we have other elected officials who have come on board.
Esplayat is big,
Espaillat,
big, yeah.
Congressman Espaillat has voiced his support for us. Um, Senator Claire, Senator Serrano, Member Gibbs, they've all voiced their support for us getting a new emergency department. How the funds come is left up to the elected officials, but we are making sure that we are pounding the pavement and generating as much support as possible and being as vocal as possible, because we believe that we deserve a new emergency
Yes.
department,
Yes.
and we believe that we can get it.
Yes.
So we are just fearless and committed.
Yeah, and sometimes it's just putting it out there,
Yep.
asking,
Yeah.
asking for those public-private partnerships. And you said the feds could also step in and help, right? City,
Yeah.
state, and federal
Yeah.
officials. All right, when we come back, I'm so excited for this new emergency room. I can already see it
Hmm.
happening. When we come back, more with our CEO, one of our favorite CEOs, talking about healthcare, hope, and of course, healing, all my favorite topics. And we do our speed round, which I always enjoy too. That's when we come back. And we're back with Metropolitan CEO Julian John. Julian, thanks for joining us. It's our final 5-6 minutes. So I always do a speed round. But first, you've won a lot of awards
Yep.
as a hospital. Tell me a
Yeah.
little bit about that.
So I just mentioned that we provide quality care, and that's both by doctors and nurses. And our nurses have been recently awarded the award for, it's called the Pathway to Excellence
Pathway to
with
excellence.
Distinction Award.
Wow.
And so we were the first in the world to receive Pathways to Excellence with distinction, first in the world. And so we're very proud of that. It underscores the great quality of care, excellence in care that we provide, clinical excellence by our nurses. Um, so we're very proud of that. And we receive a number of national awards in our NICU, the Beacon Award, Gold Awards. We received that
Oh,
2 years in a row already.
yeah.
The Emergency Department has received the Lantern Award, again, a testament to the great nursing care we provide
It's
in the
incredible.
emergency department.
Well, you know how
Uh,
we feel about nurses.
yeah,
I mean, we love our doctors, but
yep,
nurses are truly unsung heroes
yeah,
so much. They hold so much of us in their hands,
yes,
literally,
absolutely.
when we're there.
Yeah. And, I like to brag about the fact that both our nurses and doctors work very collaboratively.
Yeah.
There's no award for that, but it was recognized in our recent Joint Commission survey, where the surveyors commented on how collaborative the nurses and doctors worked in caring for the patient, and that's important.
That is
Yeah,
really important, the
of course.
collaboration. So, okay, here's the speed round that we
Mhm.
love to do. Your biggest success as a CEO of Metropolitan. What's your biggest success?
I would say two, right? One is being successful at Joint Commission as a team. Um, but I also have to say that for me, seeing the level of engagement of our staff really touches my heart. I said, because without that level of engagement, we would not be as strong as we are or as great as we could be. So I think for me is really being able to get our staff to see how important it is to be engaged as a team, and that has been driving our success.
It's wonderful.
Yeah.
Meeting so many CEOs, especially in healthcare, it's interesting to see how emotional intelligence, like you have quite a resume, but you were saying when you hit that level of excellence and achievement, you say 90% of the job is that emotional
Absolutely.
intelligence to stay in those big. Is that right?
Absolutely. The technical, we have great leaders, right, as part of our teams, and they know all the technical stuff. The CEO is a visionary, right? You have to create the vision, come up with a strategy, but you also have to be able to motivate your team and to be able to connect with your team at that psychological level. And that's where emotional intelligence comes in. How, each leader is different, right? How I talk to one leader is not the same as I would talk to another leader, right? How
Mhm.
I motivate one leader is not the same as I would do to motivate another leader, right? And you have to be able to understand the nuances and in order to be able to get every leader within your team to be able to function at the highest level possible. And I think that really, that's where emotional intelligence comes in.
So you can learn what you're saying is all the rest of it. That can
Yeah.
be taught, but it's that
Yeah.
that emotional intelligence that separates
Some
the.
people have it naturally and some people have to develop it.
Yeah.
But it's
But you
all
got
about,
both, right? I think you were born with it, and then you
I
also had
think
to.
I'm a people. I've noticed that, I've realized over the years I'm a people person. I can connect
Yeah,
with people.
you really are.
Yeah.
Yeah. And one of my favorite CEOs now, sorry for the other CEOs that have been on my show. Talk to me about hope in healthcare. We are hitting some really hard times where it is so expensive to get the care that so many of our families need. Metropolitan is always there.
Mhm.
But what type of hope can you give someone watching who may be struggling with healthcare bills? I get so nervous when I go to the doctor because you
Yeah.
just don't know what's covered
Yeah.
nowadays. Can I afford it? What do you think? Like, what can you tell us about the hope for healthcare?
You know, of course, we all hope as CEOs that healthcare will become more affordable. Um, we're not politicians, and that really is in the hands of politicians. But what we want to do is to be able, for those who are uninsured, if we can work with them to get them insured. That's our mission, right? To be able to get people who are potentially insurable to get them insured, the right insurance policy. But our goal is to really to provide access, right,
Mm-hmm.
to everyone possible. Um, and that's our focus. And it's really about making sure that we can afford the access to our community as best as we could. Um, and try to, again, you know as a CEO, you also have to be mindful to ensure that we are watching our costs as well, because
Yes.
the cost of running a hospital is not easy,
It's tough. I don't know
right?
how
And
you're
so how
doing
do
it.
we
Yeah.
manage that while looking at increasing our revenues? But that balancing act is ongoing, right? And
Mm.
so we feel by providing the right services, expanding services would help. um, but at the end of the day, we really can control certain things.
Yeah.
But the one thing we can control is making sure we provide access and provide high quality care to our community.
Well, I, for one, love to know that you're in charge.
Hmm.
It makes my heart sing to know
Hmm.
that. And resolution, what's the New Year's resolution since this is the end of the year? What are you gonna do? I
Yeah.
know mine is trying to listen more And I don't know if that's possible. My husband's probably laughing and watching this. And Joe, don't, he's listen. And also maybe eat better, because food is medicine.
Yeah,
And especially for me, it's important to keep your energy up, to eat well.
absolutely.
And I also have the CEO of a hospital on, so I, I feel like I should talk about my health. But what's your resolution?
So one is absolutely, I think listening is always an ongoing um, uh, focus. I think one of the things I really want to do is try to listen more, especially with my daughters. Yeah,
Yeah, yeah.
and some of the leaders that we have. I'm sure they're nodding their heads. But also, I just need to stay spiritually grounded.
Mm.
So my focus is to try to spend as much time with God and really, whatever time I have outside of work, really making sure that I'm connected to God. That at the end of the day, He motivates me, He drives me, and only good things can come from that. So that's my big focus this year.
Oh, I love it. You brought
Yeah,
it to the spiritual realm for that last part. I love
yeah.
that. Monsignor Kevin Sullivan was our guest last podcast. So this is a blessed, didn't he blessed our studio
Oh,
too? Did
very
you know
nice.
that?
Yeah,
So thank you so much for all the
thank
work that
you.
you do. It really is incredible work that you do for our families, especially East Harlem, our favorite neighborhood. Am I allowed to say that? One of my favorites, okay? I love so many. But anyway, thank you again for being here. And thank you for always watching. And thanks to Ponce Bank for your partnership. I have to thank all of our sponsors, Chase and Goya, for such a great year of shows. The best is yet to come. I think we're doing more in 2026, back by popular demand. I'd like to thank Joe Cole, my incredible producer, who's been through it all with me. And of course, Tatiana. Tatiana does the television and sometimes the social media. She'll help out a little bit too. Thank you for watching, and let's keep making it happen together. See you next time, next podcast.